cancer is one of the most common cancers in the world, and as you might expect, 80 to 90% of those with lung cancer can attribute it to smoking cigarettes. According to the CDC, about 200,000 people are diagnosed each year, and doctors say by the time you notice symptoms, the prognosis is grim. In order to improve this life-threatening trend, the United States Preventative Task Force, an independent group of national health experts, has approved lung cancer screening protocols for healthy patients. November is Lung Cancer Awareness Month. We spoke with a specialist at the Center for Medical Imaging about lung cancer and the steps that can be taken to detect it early.
The overall incidence of lung cancer is very high in the United States. 20% of Americans are smokers. In fact, that the results of treatment for lung cancer are so disappointing, it's actually the #1 cause of mortality from cancer in the United States. And people who have advanced lung cancer, if we catch it late when you have symptoms, I can tell you people with advanced cancer who have distant disease, the 5-year survival is less than 5%, which is awful. And if we can detect cancer early, before you become symptomatic, we can improve that to more than half. The United States Preventive Task Force has reviewed the current studies in literature and has approved a new screening test for asymptomatic patients, healthy patients, for screening for lung cancer. This is a recent development based upon a large-scale study that was recently completed, which proved the definite benefit of lung cancer screening, improving the outcomes of patients who are at high risk for developing lung cancer. We at the Center for Medical Imaging are the only approved institution in Lake County. We are ACR accredited for performing lung cancer screening. Now, the patients who are eligible for lung cancer screening have to meet set criteria. First of all, you must be healthy. You must have no symptoms. Second, you must have been a long-term smoker of cigarettes. And by long-term smoker, we define it as 30 pack years, which means that you have smoked 1 pack of cigarettes a day for at least 30 years during your lifetime. If you have stopped smoking, as long as you've stopped smoking within the past 15 years, you're still eligible. And you also need to be between the ages of 55 and up to 77, maybe up to 80, but between 55 and 77 years of age, it's been shown that we can improve outcomes. In order to be screened for lung cancer, you need to have an order from your referring physician. And you first need to meet with your physician and go over the need for having this done and make sure that you do qualify. With an order from the physician, you will find that your insurance, whether it be with private insurance or Medicare, will cover the cost of the screening. And what it entails is a ultra low dose CT scan. So the radiation dose is very low. You don't have to worry about the radiation. There's no IV. It's a lie down on the table, and in less than a minute, we get the scan done. And it's a very easy, simple procedure. The exam itself will be read by a radiologist such as myself, who is specially trained and certified, who is knowledgeable as far as the early signs for lung cancer. Being that this is a screening exam, there are many false positives. What that means is that we will see a lot of things that may not turn out to be significant. We understand that when people are ill, it's important to have the best equipment and the best physicians and the best training, and that is what we seek to provide.
For more information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Healthy Lungs Screen story link icon on our homepage, yourhometownhealth.com.